Hey everybody, we're talking traction splinting today, and specifically femur fractures, traction splinting. Now the femur is the only bone in the body that we're typically going to use a traction splint for and attempt to realign in the field. Generally we're not going to try to realign other fractures unless very specific and rare circumstances are occurring. And there are a couple reasons for this. Number one, femur fractures can be extremely painful, and number two, femur fractures can lead to significant blood loss. So how do we identify patients that may be candidates for femur traction splint? Well, first of all, we're looking at MOI. We're looking for car accidents or falls from high places, significant energy falls, but also in our elderly patients or patients with low bone density, it could be a more minor injury or minor fall. We're going to look for patients that are in extreme pain due to their femur injury, and there'll often be a significant deformity that we can look for. Now in our rigs we carry the Splint traction splint, and this traction splint is really great because it doesn't have the same contraindications as some of the other traction splints. The only thing that you need to apply it is some sort of anchor distal to the injury site. So for a lot of other traction splints, you need to have the ankle that's intact. For this traction splint, the lower anchor can be applied to calf musculature or proximal to the patella. So let's go over the parts of the Splint traction device. Inside the bag, you'll see the ankle strap, which is also can be applied proximal to the calf or the patella. You've got the main pole with the strap that sits around the hip area, and then you've got a rotational mid-leg strap that kind of helps stabilize everything during transport. On that pole, you have both a gross or coarse traction adjustment. That's this part right here, and then you have a fine traction adjustment, which is the red part right here, and this red handled cord.
You should be able to put it on in less than 60 seconds, and you can usually do it with one person. Whenever I am going to get ready to provide traction, I'm going to consider ALS for pain management and an engine company to move the patient. So while my partner's holding this foot stable, basically, I'm going to fish this strap under that little natural bridge. And one thing I want to make sure of is that this hole is pointing up towards your head, and I'm just going to tighten that strap down. So while my partner has your foot stabilized and maybe providing a little bit of stabilization up here, I'm just going to set that strap. I'm going to fish the nail into the buckle under the bridge under your knee, like that. That way I'm not jostling your leg very much. I want to make this end really short, and you'll see why in a minute. And then I'm just going to saw this up high and tight. And I want this end short so that when I start feeding this through and pulling this tight, I don't end up in the crotch as much. And I can get that snug. So then next thing I'm going to do is I'm going to loosen this black knob, load that into here, hold and pull gross traction. All I'm doing is getting this like snug, not like superhuman snug, just snug enough to where everything's kind of loaded and tight and ready to go. So I lock that off. If this isn't already loose, I'm going to loosen that one. And then on 3, we're going to pull traction, so my partner can help stabilize a little bit and pull a little bit of traction, but I can do almost all of it right here because this has a 3.5 to 1 advantage. And then I'm going to lock this off. So I can do that just myself and do the whole splint. No need to measure.
This strap is to bind the legs together. You should be attaching it below the knees, and then this end will attach to the pole. It's conveniently labeled on there that apply this end towards the patients. like so.